We are here to launch this mobile unit to make things a little easier for the Guyanese population, because we recognize with social distancing and all that it entails that we can't be encouraging people to go to the hospital. So we are coming to them. I'll begin with Dr. Boyle. Dr. Boyle, can you tell us what is the purpose of the mobile unit? What's the thinking behind this whole operation?
Well, so prior to, we had a fixed site for testing and everything was done centrally. What we're trying to do now is take the services to the people to make it more convenient and more efficient. So the mobile unit, as you see, this is a vehicle and it can be set up in several places. And we're going to go to communities that we think may be high risk or communities where we feel there might be a need for wider testing.
Are there other communities that you plan going? Is it, do you have it, already decided from East Le Penitence we're going to go next place on that?
Le Penitence, it's one of them here. And we have up on the East Coast, the Paradise. We have on the East Coast the Paradise community. There's a center established here on the East Coast, and we're looking on the East Bank as well in Horstellin to have another center established in that area, right? There are other areas that we may think of in the future in terms of where the clusters are. We're looking at the clusters as it relates to the information that we're getting based on our sampling and the surveillance activities that are actually providing that data for us.
Leston Payne, he is the deputy at the Health Emergency Operating Center, and we are at the Paradise COVID-19 Center. And Dr. Payne is going to walk us through what happens here from the time a patient identifies him or herself until the time for them to get tested, to have a sample taken. Dr. Payne is going to take us on the step-by-step procedure of what happens. Dr. Payne.
Thank you, Mr. Esibo. So, at this COVID-19 community site, right, when a patient would have entered the gate, they will be directed by health personnel to the waiting area, where they will be met by a triage nurse, right, and they will be seated in keeping with our social distancing guidelines. As you can see, it's readily identified. Right? If a patient would need assistance in terms of reading or in terms of being seated because of some sort of disability, they will be assisted by the triage nurse, right? And then they will be given a timely order, sequential and well structured, when to be directed to what we call the triage 1 area, right? Which is this area, as you can see right here. This area, your vitals will be taken, some amount of biodata, i.e. your name, age, address, and all those stuff will be done here, right? Then in a sequential and structured manner, as I mentioned before, they will then be subjected to screening 2. Right? So this area is where screening will be taking place, right? Doctor or the nurse will ask you a series of structured questions to gauge if you will be a candidate for testing, right? Screening in the full essence of the word, following a structured algorithm that we have already established, right? Now, if a determination is made by the screen 1 medical personnel, right, then you will be subjected to screen 2, where a doctor, as you can see here, right, and there are several modalities to this. Now, if for some reason the patient cannot stand, we have this as a secondary option where they will be seated and it will be adjusted as need be. Or if the patient is well enough to stand, it will be placed in this area where the swab will be taken off, right? You can take a good look at this. Right? So the entire process should not last more than 5 to 10 minutes, right, per person. Now, after we would have swabbed the patients, right, those samples will be stored and then transported to the National Public Health Reference Lab, where the actual tests will be done, right? I should take this opportunity to note that everything will be done with the utmost of confidence. The information shared to us and given to us will be kept with the utmost of confidence, like we do in most other situations. COVID-19 is no different, right? And if when the doctors would have evaluated the patient, they make the determination that, hey, this patient may need to be sent to a facility pending the results of their the COVID-19 test. Permission will be sought from that patient and arrangements will be made to have that patient transported to an identified isolation or quarantine facility. So that basically is a general overview of what will be done at the community sites.